A review into Northern Ireland's maternity services has found, amongst other things, women left in trauma, midwives working in unsafe conditions, and management unaware of problems. Today's report by Professor Mary Renfrew includes a number of recommendations to overhaul maternity services during the next 5 years.
The review was sparked by the death of baby Jackson McVeigh after failings at the Lagan Valley Hospital in March of 2017. Jackson's mother has told UTV that the scale of concerns raised by the review team was frightening. Here's our health reporter, Deborah McAleese.
From the second we went into the building that night, it was nearly this bad feeling, and the place was in darkness.
Unfortunately, Christine's instincts were right as she walked into Lagan Valley Hospital 7.5 years ago to deliver her baby. Her son Jackson was stillborn after complications arose during delivery at the midwifery-led unit.
I could see things happening and knew things weren't right, and could see panic in eyes, and just could see that evolving around me. It was very clear that there just wasn't enough people there. There was nobody for them to seek help from.
It was Jackson's death that led to this review of maternity services across Northern Ireland. A review that has flagged up many issues, including traumatic experiences for women, unsafe working conditions, lack of staff, and limited scrutiny. Midwives told of their concerns for women and babies, saying they were working in conditions where they cannot consistently give the quality of care needed. One staff member told the review team that the workload frequently leads us to working from 7:30 a.m. to 8:30 p.m. with minimal or no breaks. Not only does this lead to patient safety being compromised and an increase in adverse incidents, it also leads to a range of issues with our own physical and mental health. Speaking in the Assembly earlier, Health Minister Mike Nesbitt said immediate action was being taken to stabilise services and that recommendations within the report were being considered.
We've got to get this right, and I'm not going to sit and just ignore those recommendations. I want the best possible service.
However, he said the time was not right for the opening of new community midwifery hubs, as suggested in the report.
I'm not saying no to them, but I'm saying the time, in my view, is not right. And so I think we've got a lot of work to do before we go for those community hubs.
The recommendations for change come in the face of considerable challenges, including the rising cost of the delayed opening of Belfast's new maternity hospital. But politicians have been warned that the next steps are critical.
Maternity care is a platform for addressing inequalities, for improving early years, for improving public health. You really can't make much progress on any of those issues, improving mental health, unless you get maternity care right from the start.
The Health Minister said he wants future maternity services here to be world leading, but it is the present that is a cause for concern for many women.
I know that I'm not the first. I know that Jackson will not be the last, as things currently stand.
Christine McCleary there. Well, Deborah joins me now in the studio. Deborah, only last week, we were discussing the concerns about the maternity hospital at Daisy Hill due to staffing issues. Has there been an update?
Rose, as you've just heard from that report, staffing issues and staffing problems were very much a big problem across maternity services in Northern Ireland, and the outworkings of that are really being felt in the Southern Trust at the moment. It was only a few weeks ago that some maternity patients had to be transferred from Daisy Hill Hospital to Craigavon. Earlier, the Health Minister told the Assembly that the Southern Trust was late in advising him just about the extent of the issues being faced. Now, he insisted that not having maternity services within Daisy Hill is not part of his plan. But if you listen to him here, it is clear that he is very angry about the situation.
Any reconfiguration must be planned and managed. It should never ever be as the result of service collapse. And I do not want to see service collapse with regard to Daisy Hill and maternity services. And I can tell you that meetings continue at the highest level this week to look at what are the available options to resolve these issues. But I hope the member gets the sense that I'm not happy.
So Deborah, can you be specific about what's being considered to protect maternity services in the Southern Trust?
Well, there are a lot of conversations ongoing at the moment, but it's clear that the Southern Trust is going to have to look at how it can rearrange its workforce. And if it can't do that, it might have to look to other trust areas to see how they can fill that gap. Now, very interestingly, while he was speaking in the Assembly earlier, the Health Minister mentioned that if the Southern Trust chooses to make a temporary decision over maternity services, he can't do anything about it. Now, he didn't expand on exactly what those temporary decisions could be, but maternity staff within the Southern Trust fear that that could be the temporary suspension of maternity services at Daisy Hill.
Deborah McAleese, thank you very much.